My goodness, we have a huge show today. Looks a little different, doesn't it? I am coming to you from none other than the local studio. We have Dr. Peter McCullough coming in here. You've seen him on this show. You've heard him. We got a lot to talk about with him. His new book is right here, The Courage to Face COVID-19. We're going to talk about that. Steph Coulson is here as well. She is from Holistic Goddess, which has overlap with some of the products that Dr. McCullough and I are working on, so she's going to be here to represent those products. And then the great Dave Rubin comes in about 20 minutes. So it's literally too much show today. So you do not want to miss this. Dr. McCullough, Steph Coulson, Dave Rubin from the local studio. Be right back. Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say. Well, Mother's Day is upon us, and Genucel's Mother's Day sale has arrived as well. Perfect timing because Susan and I have upgraded our bundles with even more of our favorite skincare products now for over 50% off. We've been working with Genucel for almost 2 years, and because Genucel makes really the best skincare products in the world, you'll see. In fact, you can see how my skin corrected and repaired in this moment from the show live on our stream. And we know it's important to you. Genucel products use naturally effective proprietary ingredients that are non-GMO, plant-based formulas made in the USA. Just some of the reasons Genucel has 400% the customer loyalty of other skincare brands.
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com.
For now until Mother's Day, order Susan's Essentials package to get her favorite Ultra Retinol and Vitamin C serum, as well as other skincare must-haves. Order right now at Genucel.com/Drew and get a free luxury spa box that includes their incredible neck treatment, a free gift, plus free shipping. That is Genucel.com/Drew, GENUCEL.com/DREW. As I said, too much show today going on here. Dave Rubin will be here just a second. His book, of course, is Don't Burn This Book. Thinking for yourself in the age of unreason. That's going to be the theme for the show because Dr. McCullough, who is in studio with me, will remain so throughout the course of the program. We were just talking about the unreasoned sort of nonsense that went on during COVID that we had to endure.
It was extraordinary. A brand new problem, a brand new virus that none of us had encountered before. And before we knew it, we couldn't talk about it.
Forbidden. Everything was safe. Everything that they determined was safe or useful was safe and effective, and everything else was dangerous. It was the weirdest thing I've ever been through my whole life. We lived through the AIDS pandemic or epidemic, and we were carefully discussing everything all the time, like a tumor board all the time. Anyway, follow Dr. McCullough at petermcculloughmd.substack.com, petermcculloughmd.com. Are you on X? Yes, at Peter P_McCullough MD, McCullough. But we had a 3-shot here where my second guest, you just saw her on camera, which is Steph Coulson. We're going to discuss some products with her first. Because I want to mention before I do get to you, that we were talking about functional medicine, and you were saying that you have patients that need stuff like this.
For sure. We get to a point I'm a traditional allopathic doctor. I see and examine patients as an internist and cardiologist, and largely I prescribe drugs, prescription drugs. But there's an entire world out there of nutraceuticals, a variety of other products. There's hands-on physical aspects of things, novel approaches that we are now finding are so complementary and help our patients so much.
Well, I was just thinking about some of the stuff that we're on the wellness company medical board, and I use this sleeping pride. I'm laughing because I rave about it all the time. But that ashwagandha and dandelion root, I would normally be like, maybe. Oh my goodness, that what's called Restful sleep. Anyway, Steph, tell us your story. Thank you for being here.
Thank you for having me. Thank you. I'm Steph Coulson. My husband is Foster Coulson, who started the wellness company that, of course, you guys are both a part of. And I watched what you guys were able to do and coming out of COVID and helping people who've, possibly had a vaccine reaction, who are just trying to find their way. This is a time of trying to find your way. And I felt so inspired by the amount of people that have been helped so far. And I thought, well, but there's women too. And I have, a personal story about overcoming hormonal issues, a personal health journey, as pretty much every woman you will talk to has.
Well, let's kind of drill into that, because certainly as you hit sort of, and you're working with Jim Thorpe to try to come up with some products for that. Jim
I am.
Also,
it's pretty amazing.
Yeah, he is also on the Wellness Company Medical Board. But you can tell us about that in a second. But I was just thinking about how, as women go through life, most women get a very unsophisticated analysis of what's going on for them hormonally.
Absolutely.
Particularly around perimenopause or post-pregnancy.
Yes.
There's a lot of throwing antidepressants at women, which I now find borderline reprehensible.
Yeah, it's so true. And it feels like obviously medical doctors 100% have their place, right?
Of course.
And we all need you guys in our times of need. But there are also things where I feel like in our Western medicine society, we've come a bit too far, where you're having hormonal issues, you're having excessive bleeding, we'll just have an ablation. Well, scar tissue in the body is kind of a problem, or get your uterus out. And those are kind of your like cut and dry answers. Well, what if you can do something else? And that was sort of my journey, is that my hormones entirely fell apart at the age of 28 after the birth of my daughter. And all of my hormonal testing showed that I had the hormonal levels of a 65-year-old woman.
Oh, you were getting early menopause sort of picture.
Completely. Yeah. Hot flashes, night sweats.
Oh, boy.
The massive amounts of anxiety.
Did anybody try to... Now, people, first of all, as men, I had to apologize to Naomi Wolf for sort of blowing off the menstrual irregularities associated with the vaccine and things. I'm like, Naomi, menstrual everything. I mean, women, I was so mad
I was
at
one of
myself.
those people, I'm just going to say.
I know, and I was so mad. It was so sexist. It was so misogynistic. It was so inappropriate to me. And I apologize to her to this day. But that this really affects your functioning, your affect, your ability to parent.
Entire life.
And if you want to have more children, it certainly affects fertility.
Of course.
It's a massive thing that we have blown off as a male-dominated sort of medical system. Right?
But some of the biggest studies of vaccine side effects, and particularly even shedding, that is a vaccinated person or a patient sick with COVID around somebody who is not, are actually done on menstruation. Some of the biggest one, a big one in the UK, is called the EVA Project. And what I recall from that is 75% of women are affected. Their menstrual cycle is affected by SARS-CoV-2 in some way, the infection or the vaccine.
One of those women.
Because remember, we have this cycle. It's a very delicate time cycle.
So do you think that you were a vaccine or COVID reaction or both?
So I am unvaxxed. And every time that I would leave my home to be in a crowd around lots of vaccinated people in a sports arena, on an airplane, within 3 to 4 hours, I would start to bleed. No matter what part of my cycle I was at. And I would continue spotting the entire time that I was away, whether it was a week or a day. And it was constant for me for almost a year.
So that helped motivate you to create some of these products.
I took the spike support that you guys know all about. And within probably 3 months of taking it, that stopped for me completely. I have no irregularities, no reactions.
That's about it.
Nothing.
So spike support is its base ingredient is nattokinase.
Yeah.
A Japanese invention, 1,000 years old. It's derived from the fermentation of soy, combined with 5 minor products that actually all have an evidence base to help the body manage the SARS-CoV-2 spike protein. And it really, and the timing is perfect. It's about 3 months. It's not instantaneous. We always tell patients it's going to take a long time, because these are forms of enzymes and natural substances that really have to get in the body and circulate. And the body has to see these from an oral ingestion perspective a couple times a day.
And so there you were, you got better. And then you decided you wanted to do this?
I mean, I went through my whole health journey after my daughter was born, as I said, and I knew that there was a different way to do things, because I took it into my own hands, right? That's something we talk about with medical freedom. You really have to own your wellness. You have to be your own advocate. sometimes you got to do your own research and figure out what works for you, what doesn't work for you. I really believe that every body is different, right? Every person is different. What works for me is not going to work for you necessarily. That's okay, but you have to be willing to do the trial and error. And I did that.
And you found some of these things?
I did. I absolutely did. And then I watched how TWC was able to help people's lives. And I thought, well, I want to do this for women.
I've been a big fan of the trifecta.
It's pretty amazing.
Because I was I'm screwing around with my diet all the time, and I was on carnivore for a long time. And and the carnivore world will tell you got to eat viscera, you got to eat more organs, and I don't like them. So this helped with that. And to be fair, everybody should be eating more organs. That's one of the things. There's a lot of things we don't do in modern society that we just should be getting access to, and the whole animal has nutrients.
Yes.
And eating close to the bone is very important as well. These are all things we don't get the natural resources, but
it's
you
so
guys
true.
have.
Well, we have the liver. So how I started on liver was my naturopath amidst all of my issues. I bled for 8 months straight, which is a lot on your body. My ferritin was 4. I was falling apart with a 9-month-old baby.
Right.
And I didn't want to take iron supplements can be really, really tough on you. And I'm incredibly sensitive. So I didn't really want to do that. So my naturopath, okay, you can take beef liver. We'll test you again in 3 months. We'll see how you do.
Did you have any infusions of iron?
I didn't know.
Wow.
I did not.
Just so people know, a ferritin level, which is kind of the storage tank of iron, I like to see my patients at about 200. People can clearly have symptoms at ferritins of 20. You were what?
4. I was really in trouble.
Yeah.
Absolutely. I mean, when you bleed every day for 8 months, your body's not supposed to sustain that.
So no infusion, no iron supplement, and you use this product.
I did beef liver, and then we found the bison. And when we found the bison, I was like, hey, educate me. Why is this better? Well, did you know an organic cow can receive 17 vaccines but still be considered organic?
Well, I believe, what about hormones and antibiotics and other things? That
GMOs that they get fed, all the things.
Right.
Those
so this
can
is
all
in
be
cattle.
present.
This is actually bison. So it's much more natural.
It's
no
completely clean.
vaccines,
It's
no hormones.
Entirely unadulterated source, as opposed to the beef, which is what we traditionally get in, a health food store these days. So when I made the switch from beef to bison, and I realized within 3 days how powerful it was. It's literally, you can feel it. You've tried it.
Yeah, I still take it. I still do. The trifecta is one. Tell them about what trifecta is.
Trifecta is heart, liver, and kidney. Yeah. This is the liver I wanted to spotlight because it is really great for women specifically, hormonal support, collagen support. And it's a great jump if you already do beef to just the education process I find is a lot easier.
Tell us about the other products.
We have essential oils here. These are organic essential oils.
I don't understand essential oils.
Really?
How do people use them?
Yeah, that's what I was going to say. A lot of women swear by it. I don't get it.
Before I did this.
This is my stupidity again. I'm fully copping to it as a male.
Totally.
To help me understand.
So before I did this, I did oils, did my course, did all the things, made products, went to farmers markets, had them in health food stores, like locally where we live. It was really great. But I fell into the oils because my son is 10 and he was extremely colicky. Didn't sleep. I tried everything that you can possibly try.
I bet you said he has too much horsepower.
He does. He definitely does.
Actually,
he sure does. And it wasn't until somebody was like, well, why don't you try some lavender essential oil? And I was like, what do you do? I didn't even know what an essential oil was.
Where do you put it?
Well, you have to dilute them. You can't ingest them.
Okay.
Some people will say you can. I promise you can't. Don't do that. You can make cleaners with them. You can make little sprays with them. You can put them in the bathtub. You can dilute them with a carrier oil and put them on your pulse points. Okay. It's depending on what you're trying to do.
Do people ever put them right here
under their nose?
I would not put it directly under my nose. I would put it on a cotton ball and then sniff it. If you were looking, if you were doing eucalyptus.
Neurochemicals, is that the idea? Or what,
it depends what you're doing. Lavender is obviously very calming. Eucalyptus is for congestion. Peppermint I love for headaches. I'm a migraine sufferer. So I just dilute it, just like a little bit of castor oil.
If we think in terms of mechanism of action, it probably changes vasodilatation and the nasal passages.
I mean, what I know about them is actually they do change mood.
Well, that's going to say raise neurochemicals.
Yeah, right. So it's one of the few things that can actually change your mood.
And they're ancient.
And I get calls regarding patients who just where something is off, and really the prescription is they need a change of mood.
It's so true.
We are not paying enough attention to our brains, and it frustrates the hell out of me. And it doesn't have to be done through pharmacological agents. Sometimes life-saving. sometimes as many other things we could be, including just close relationships and 12s, all kinds of things we can do. This to me seems like one of those things that,
and it's easy.
It's easy,
and if it doesn't work,
this is what kills me.
It's no harm, no foul.
Exactly, things that have no downside, they get attacked. Like, come on.
That's how I feel about seed cycling, right? Many people don't know what seed cycling it is, but it's the idea that you can eat a different type of seed according to where you're at in your cycle, and it will either raise your estrogen or progesterone within your body. Just seeds that you would buy at the grocery store.
Seeds like pumpkin seeds kind of thing, or
sunflower,
sunflower.
Just ground up in yogurt. It's 2
I eat
tablespoons
lots of
a day.
nuts.
It's really not. And if it doesn't work, it doesn't work. But also, it's seeds. Like, it's not a drug that you're trying.
But isn't it true that, modern medicines, prescription drugs have only been around 50 or 60 years?
Yeah.
That what did mankind do for thousands of years?
Yeah.
To kind of manage?
Yeah. Not only that, how long has the randomized placebo-controlled trial been around? 50 years? 75 years, something like that. It's something on that order. And that now has become thus saith the Lord.
Right.
I mean, it's a good instrument. I'm not being critical, but we treat it like it is literally, again, back to a religious sort of, like it is some canonized.
What was it? Before randomized trials and before modern computation, what was it? It was
doctor's impressions.
It was clinical
observations.
Yeah. So it was clinical observation. Empiricism. Empiricism means give it a try.
Yeah. Which is why I knew we'd get out of COVID in good time without a lot of disaster, because we do that. And it's interesting, our surgical colleagues were the ones doing it the most, because they're not used to having those of us in the what we call the intellectual now, the disciplines, that we have regulators all over us all the time. And we are not at our liberty to do almost anything. And surgeons always have, when they're in the surgical field, they make all the judgments. Nobody's allowed to question it. I mean, they can do the wrong thing, but when they're making those decisions, it's on them. So they're used to improvising. And tell me about the product in the front here.
The pink label is Brain Joy. So you were just talking about that. It's formulated for the health of your brain. So it has ashwagandha, lemon balm, ginkgo, ginseng, and turmeric.
So where do you put it? How do you use it?
It's 2 capsules a day.
That's ingested.
Okay, that's an ingestion. Okay.
Yeah. And it's for the health of your brain, but because it has that ashwagandha in it, it's very calming. And most women I talk to need calming in their lives.
I think we all do now. But I notice ashwagandha, I get a little tolerance to it, I think.
Do you?
I think I do. Because after I have to take breaks regularly to get the same effect.
But see, that goes to everybody is different.
Yeah.
Right? I don't find that, but then you have to be willing to play around with these things. Yeah. See what's really going to work for you.
And the other one?
I believe it's Meta Radiance.
Meta Radiance?
Pretty sure. That's the Brain Joy. Okay. This one I'm thinking.
And what's that one for?
It is. This is a metabolism booster. And it's just spices, black pepper, garlic, cayenne pepper, ginger, and one more that I am blanking on this very minute. But it's literally spices that you would take from your cupboard, except you're not going to do that because we're all busy and we're not going to do that. And it's same thing. It's 2 capsules. Lots of women, especially as they get older, I've noticed even when I hit my 30s, your metabolism slows down for sure. For sure.
All of us. Did you work on it with a naturopath? How did you formulate these things?
With a formulator, a professional formulator.
Were you coming up with these ideas and these combinations, or was there the formulator as somebody with naturopathic training?
Coming with ideas and then making sure that a professional is making sure that everything is exactly as it needs to be within all FDA regulations and all those things.
Well, listen, we're big fans, and like I said, I take Trifecta every day. I literally do.
Awesome.
Somebody said, well, don't you feel, you asked me on the phone the other day, you go, don't you feel better? And I go, I'm feeling pretty good anyway. I just feel like that's an important way to fill out your nutritional profile.
It really is
with Viscera. And it's just important to do that. Whether you need to feel something or not, you felt something when you took it.
Yes. Yeah. And most people, especially, I'm spending my time talking to women, right? Because we are an extremely women-focused company. But most women feel something, but I notice it's different based on what your deficiency is, right? Everybody's different. I have a friend who is taking the Trifecta. She's in perimenopause and her cycle's 24 days. That's pretty short. That's a lot of bleeding. I'm just going to say it's a lot of bleeding. And she's been taking Trifecta for a month and her cycle's lengthened out to 28 days.
Wow.
Excellent.
That very hormonal support. And she's like, well, this makes a huge impact in my life because if it continues, that's 2 less periods this year.
Yeah.
That's a big deal.
I wouldn't know that as a male. That's my ignorance.
We talked about this.
But
the man's hormone cycle versus the women's.
I wouldn't
It's
know
very
it.
different.
And the fact that it is a bit, we're hearing preach from the audience. But the fact that we wouldn't know it and we have not paid attention to it as a profession, that kind of nuance, we would never, it doesn't even come up.
For sure.
And yet women's lives are deeply affected by it. So
And we
I
all have
apologize.
women in
I
our
apologize.
lives. You both have wives.
Naomi, I apologize. Susan, I apologize. Steph, I apologize. I still have, but at least I'm trying. And so to say 2 more menstrual, 2 less flow cycles a year
That's
is
a
meaningful.
huge difference.
I would not have known that. So,
Yeah.
good.
Pretty major.
Well, listen, we thank you for coming in. Thank you for the product. We're big fans. Peter's
you.
going to stick around. We're going to switch you out for one Dave Rubin.
Awesome.
You're far more delightful than Dave is. But we appreciate everyone being here on the show. Again, let me give you a particular.
Studio audience over here.
All right, Susan's yelling at the studio audience. I want to point out Peter's book again. There's you get is that a discount? Yes, a discount at Holistic Goddess. There
Promo
you go.
code Dr. Drew.
I did not know that. No, it's doctor.com/Holistic Goddess. I think you automatically get it.
That's
Yes,
for these products
that's
here.
right.
Yeah, go for it.
Yeah.
Use promo code.
We have a whole trusted
Drew,
brand
Dr. Drew.
marketplace.
Okay, I see it.
It's worth checking out.
Peter's book. Any special code for your so,
CourageToFaceCovid.com.
all right, check it out. Susan and I are both reading it. It reads like you go ahead and give that little pitch because you were absolutely spot on about how it drives.
Yeah, we so many books, in a sense, are kind of boring timelines or boring narratives. John Leake, who's a best-selling author, I wrote it with him. We wrote it like a gripping true crime, nonfiction, but it moves. It has, stories have to have a beginning, middle, and end. That's how the human mind understands things.
Yeah.
Through stories. Courage to Face COVID.
Well, but what you went through was more. I I knew you went through a lot, but when you really see it laid out, attack after attack, loss after loss, unjust. I don't know what to call it. You went through. It just was. It's really quite breathtaking.
But I've done thousands of interviews. It's never about me. It's about the patients who suffer. That's what this is really about. People were denied early treatment. They've been harmed. There's been loss of loved ones where they've never had a chance to say goodbye at the very end. What happened through the pandemic
really
was
beyond
heartbreaking.
Beyond. The whole thing was disgusting to me. But we've talked about it before. We'll talk about it again. All right, stay right where you are. Back with the great Dave Rubin. Let's talk about aging because everyone wants to know how to slow it down. For almost a decade, I've been taking a healthy aging supplement called True Niagen. This supplement boosts NAD. That's something that cells can't live without. It's done with a patented form of nicotinamide riboside called NR, or Niagen. It's more efficient and more scientifically reviewed than NMN or other NAD boosters. True Niagen is truly the best way to boost NAD levels, and it's made by Chromadex. They are the gold standard in the NAD space. Dr. Charles Brenner, the scientist who discovered the NAD boosting potential of NR, explains.
And the center of the metabolism that allows the conversion of food into energy is NAD coenzymes. And NAD gets disturbed in the aging process. And as we're exposed to conditions of metabolic stress, Niagen, which is the form of NR that was developed by Chromadex, is the best and the only fully legal form of NR. And this is really the gold standard for NAD boosting vitamins.
I love this product. I urge you to try it. Go to drdrew.com/True Niagen for 20% off your order. That is drdrew.com/True Niagen, TRUNIAGEN, and enter Dr. Drew at checkout, DRDREW, enter it at checkout for 20% off. You asked for it, and the wellness company has delivered. The medical emergency kit, replete with ivermectin, prescription antibiotics, and more, continues to fly off the shelves. We keep one here at home. And there are 3 new kits you need to know about, and more are coming. The Contagion Emergency Kit was inspired by the high demand for the medical kits. In that Contagion kit, you'll find ivermectin, hydroxychloroquine, antibiotics, budesonide, and a nebulizer. And a must for your next trip is the Travel Emergency Kit, something I made sure exactly what I give my patients is in this kit and some more. The kit includes remedies for jet lag, variety of infections, even GI ailments, Imagine your flight getting grounded anywhere, say even in the US, and you start getting sick. You do not want to be at the mercy of the US healthcare system or any healthcare system. At home, we keep the ultimate first aid kit on hand. It has over 20 essential supplies and medications for situations when time is of the essence. Order one for your car and your go bag. Because these kits contain prescriptions, your purchase includes a telemedicine consultation as well as an instruction manual. Go to drdrew.com/TWC for 10% off. That is drdrew.com/TWC for 10% off all your orders. I'm very excited about these kits. Go to drdrew.com/TWC. And we are back. And I think, Caleb, you're supposed to throw, there we are. We're on the road. And as you see, I always bring Paleo Valley bone broth and beef sticks. The venison sticks are insane. They're my favorite. Everywhere I go, we always have them. We had them in our coffee this morning. Not them. We had the bone broth there, the chocolate one in particular. So you can go to drdrew.com/Paleo Valley for 15% off your first order, 20% when you subscribe. It is drdrew.com/Paleo Valley. Oh, she's bringing in our bone broth and beef sticks from Susan. You want to say hi behind me as long as you're in the picture? No? Yes? Here she comes. And all right, she's it's straight ahead. All right, so Dave Rubin, the host of the Rubin Report, author of Don't Burn This Book, Thinking for Yourself in an Age of Unreason. So that title is like ringing in my ears.
It's great.
Dave Rubin founded this, Locals. This is Local Studios. Did you ever imagine Locals would be what it became?
I guess I imagined it, but I didn't think it was going to happen because for the first 2 years of fundraising, basically, I went to everybody. I mean, every big VC firm, everybody in Silicon Valley while they were still there.
Yeah.
Many of them have now moved here to Miami post-COVID. And basically, everybody said this, wow, this is a great idea. Creators should own their own stuff and there shouldn't be a middleman with big tech. And nobody pushed back on the idea. But they didn't like the idea that we were in the free speech space. So they would all get very quiet once we walked out of the room. So we'd have great meetings. Every meeting that we had, I'd walk out going, wow, I'm sure we're getting cash out of that one. And then the phone would go cold. And then over time, eventually, the one that really broke it for us, and I like giving him public credit, was David Sachs, who you guys are probably familiar with, who was the COO of PayPal, part of that original PayPal mafia with Elon and with Peter Thiel. And he saw it in us. I met him at a party one night, didn't even realize who he was. I just was having a chat with a nice person. And then I walked away and someone said, oh, you know Sachs? And I said, who is he? I don't even know who he was. Anyway, I got on a call with him maybe 3 days later. And he immediately said, I'm in. He looked at the numbers in 2 minutes, as opposed to these 5-hour meetings that you have with people where they open the hood and look at everything and then they do nothing for you.
Yeah.
Had a 3-minute call with him. He was in. And then that opened the floodgates for other people to say, oh, I can get in this too. And, there's a little force field now.
And now we're in the studio.
Yeah, and now we're in the studio and we merged with Rumble. And I think we're on the forefront of saving free speech online.
Well, so to me, a lot of what that story is the insanity of our present moment, the arc of the present moment, which is in your book.
Yeah.
And when I hear that people push back to you because you're in the free speech space, I hear that you were radioactive because people wanted to cancel you because you dared to. I dared to do what? To just talk,
Well, I've survived a couple of cancellations over the years, as you guys have as well. I mean, it's gone in phases. First, it was really because I was a lefty. I considered myself, and still in a truest sense, I consider myself a classical liberal, but I was a lefty, sort of on the progressive side of things, talking about what I saw were the obvious problems with progressivism that I think we're now seeing on college campuses and virtually throughout all of our institutions. And I was kind of just lightly pushing back on that. And I was getting a lot of hate for that. And the New York Times said I was the head of the alt-right, or one of the heads of the alt-right, which we now have. It was a front page Sunday New York Times, which we now have in my studio. It's framed nicely. I'm very proud of that.
Do you think some of that was Trump derangement syndrome? It feels like some people went hysterically insane.
I wasn't even a Trump supporter.
No, I know. But it just became this weird witch hunt.
Well, I think there's been a series of things that have really broken people's brains over the years.
Yes.
Obviously, Trump derangement syndrome was one of them. I think a media that has just failed us miserably, a mainstream media.
Yeah.
I think COVID, for a million reasons that you guys are very well familiar with, just broke people in half.
That's what showed us so much. But you got to interview Cuomo. You need to interview Cuomo.
So we played the clip on my show today where he said that he's now vaccine injured. And then we also played a clip where a compilation of him on CNN basically guilting people into getting the vax. And I would love to have that conversation with him because I don't wish anyone ill, of course. I hope he's okay. He didn't really get into the details of what's going on with him. But you watch the minute-long compilation of him telling people that they should have passports and not go out and stay home and all of this stuff. And now he's one of the people that was affected by that. And you can only imagine how many people he might have as a primetime CNN guy influenced to get the vaccine.
And then the first, I'm going to let Dr. McCullough address all that stuff. And we in our promo said we talk about mRNA and cancers and whatnot as well, but we can get into that later. But there's an important story to be told that Dr. McCullough then comes in this whole cancellation, where the on the physician side and academic side, the people they chose to cancel, that Cuomo and his thugs at the time, and the whole group that would come after anybody, particularly in the FLCC, and we'll go. Were you in that group?
No.
Yeah, that was Jay Bhattacharya, who's the poster child for this. These are extraordinarily accomplished professionals, decorated teachers. Give them your base, your outline of your story.
I mean, what was going on in 2020 was amazing. Scott Atlas was at Stanford. I was at Baylor. We were both asked by invitation to write op-eds about what was going on the pandemic in the Hill, which is widely read by the House, the Senate, White House, inside the Beltway. And so we were writing, Scott was writing about the public health, masking and lockdowns. I was writing about how the virus is moving and about early treatment, that we're going to have to treat sick people. At some point in time, there's two bad outcomes: hospitalization and death. And if we don't do anything at home, there will be no way to stop this progression. And as things moved along, Scott ultimately went into the White House for a period of time. I became a frequent contributor on Fox. I went on well over 100 times. We felt, all of us, Scott went through censorship at Stanford. I went through a whole series of progressive things that happened to me professionally. It's in my book, Courage to Face COVID-19.
This you got to read
the book.
Can I give it to Dave? Because he needs to read this book. This is his historical document.
I would love to read it.
Dave, the title of your book is Don't Burn This Book.
Yeah.
This book, Courage to Face COVID-19, is a 5-star seller on Amazon. John Leake, who's the main author, is already a best-selling author. So he's already got it, right? This is on Amazon for 18 months. We get a notice. Amazon says, we're taking it down. We said, what? Why?
This is burning books.
Yeah, it's burning books.
Right? How you destroy the book doesn't matter. It doesn't have to use flame.
Right. So here's the point. They said, well, it has offensive content. We said, where is it? I don't even cuss. Yeah. I mean, there's nothing in there. There's no nudity, profanity, no hate speech. They said, well, we can't tell you where the offensive content is. So what happened was, perfect, right? I put this out on Twitter. I said, Amazon is pulling our book. People took pictures of the brown shirts in Nazi Germany burning books. Mm-hmm. They replaced the Nazi swastika with an Amazon logo.
Yeah.
And this was all over. Yeah, it was all over social media. A lot of people got involved. Now, fortunately, the publisher Skyhorse, Tony Lyons, got involved. And after 12 days, Amazon said, we made a mistake. We're putting it back up.
Oh.
But what influenced Amazon to do this?
Well, is it
to essentially burn the book?
Yes.
So Mike Benz has been on this show many times.
Whatever you want to call it, it's that. It's that. Unfortunately, you guys may remember the story of when Jordan Peterson, when 12 Rules for Life came out, they had a complete upheaval at not Simon & Schuster. Who's the other big publisher?
HarperCollins.
Was it HarperCollins? I'm blanking on who it was. Right. It was Penguin. Thank you.
Yeah.
And it wasn't the executives that were not happy. The executives were thrilled. I mean, the book was selling millions and millions of copies. I think it was the #1 book of 2018. I was on tour with him. I mean, I saw the fruits of that. The guy was selling out, 7,000-8,000 seat theaters all across the world as a clinical psychologist. I mean, you would have ever thought that could happen, right? But it wasn't the executives that were upset. It's the underlings. It's the sort of managerial class. It's the kids who just got out of college and then they start complaining to the higher ups. So my guess is it was probably not a very high up Amazon executive that top down took you out. They get some complaints. And then it starts percolating throughout the system. And unfortunately, we don't have a lot of bravery in the world right now, or certainly in our institutions, and then they get corrupted. And that's what we're seeing on college.
By the way, the Freedom of Information Act that came out on the Twitter files, when the Twitter files were released, it was exactly that. It was kind of these underlings, exactly what you said.
Yeah.
So what's to be done? That begs the issue. Are we seeing some sort of, I don't want to say a sea change because it's clearly not that, but did the what's going on college campuses put people on notice that it's going too far? Or
well, I think we're seeing a sorting. I think we're seeing a sorting the way that you and I have discussed many times, the great sorting of America in terms of where people live. I lived in California, in Los Angeles, until December 17th, 2021, when I got to Florida, and I'm never leaving here. I think we're going to see that sorting happen in all of our institutions.
Do you know that Osama bin Laden's goal was to try to break down the U.S. into 50 independent countries?
Well, then he had a little something in common with the guys who wrote the Federalist Papers, because that's sort of what they wanted too, in a way. I'm not for secession or anything like that, but largely what happens in your life should have way more to do with the state you live in than the federal government. We now have a very large federal government, and states that are in many cases completely non-functional. California and New York, states that should be leading the nation. And then we have a place like we're in right now, Florida, where everything is functional and everyone is moving here. And whatever our problems are, it's not to say there are no problems, but they're a function of our success. We have very high house prices right now, but it's not because the houses are just sitting there with no one trying to move in. It's because there's insane competition with all the people fleeing. So I sense in our institutions too, something like Columbia is now a Frankenstein monster.
Yeah.
If you're the parent of a 16-year-old kid,
no way. You spend 80 grand? No.
No. So the sorting has now begun.
80 grand a year.
And I think,
80 grand a year.
Right, 80 grand a year. So I think what will increasingly happen is the progressive wing, whatever this thing is, they will have taken over much of the Ivy Leagues. They will still have a lot of power in media and elsewhere, but everyone else, and I mean, it's basically everyone that's not woke, and that is the most of the country. I think they will start building new things. That's what we did right here. I think they'll be building new institutions. I was just at Ralston College in Savannah, Georgia. Absolutely wonderful, teaching a classical education. University of Austin in Texas, and new things will be built. And there will always be a tension between those two things, because a certain set of people won't be happy about those new things being built. They want the monopoly on everyone's minds. But I sense that that's really where we're going to go with all of this.
It's really sort of with the wellness company. It's kind of the philosophy that really I adopted as a motivating to come into the wellness company.
It's
meeting a need, help people that feel that people are providing them services and goods or hate them or couldn't care about them.
Yeah. Well, I love
the opposite. This is the opposite. We
care
very much.
I'm not kidding. You guys know what it's like to read ads on podcasts, but I love reading the wellness company's ads because it's true what I'm reading. You know what I mean? 100%. Like I am reading it off a teleprompter.
Have you met everybody?
And I editorialize. I don't think I've met everybody in here. But hi everybody. They're all smiling too. So that's nice. But it's true.
I pulled a couple of our leaders aside and I said, "Thank you for being who you said you were." Which is a rare thing these days.
Yeah, that's the rarest.
Well, isn't that true? Through the pandemic, we met each other over Zoom, or over prompters, and then when you actually meet people in person, you say, "Wow, Dr. Drew he's a pretty reasonable guy." And I tell all the girls who follow me, I said, "Yeah, he is as handsome in real life as you see him on TV, and he does juice on a lot of supplements." But
I do eat much supplements.
What we have learned is that people want to manage their own situation a lot more before they pull the trigger and go to a doctor.
Yes, there's that on the medical side, but I think that goes out a little more globally. If people want to be left alone to manage their own lives.
Yes.
Why is the blob? Why have they adopted this sort of un-American, centralized, really what they don't understand? Power. But listen, what they don't understand is this all started with the Jacobins. They created this model of a centralized, at that point, it was a monarchical administrative state. Then the Russians and everybody turned it into a single leader administrative state with a charismatic leader. We're going back now to the bureaucracy itself, the blob, being the things that runs our life, which is back to feudalism.
I think if you confuse an entire generation of people about the founding of the country, in this case, the United States, which is the greatest human experiment ever, that everyone in this room and everyone watching this, if you're an American, your ancestors had it worse than you do. It has worked here in an extraordinary way. The default position of humanity is not that we basically get along. I know there's some strife on our streets right now, but what we have done to bring everyone from every corner of Earth into this country and make it roughly work for 250 years is a freaking miracle.
Yeah.
It's a miracle, and it's a very precious gift that we seem like we're slightly handing away. But I think that the general default position of humans is to want to control each other. And that was one of the things that really, if I was being slowly red-pilled for a couple of years, once COVID really kicked in, And the more they kept saying, you must get vaxxed. And for the thing that really clinched it for me, you know this, is that I had 2 small companies. So I didn't have 100 employees. I think it was OSHA was 100 employees. They were going to force you to vax them. But I had a couple employees in 2 different companies. And I'm sitting in the studio one day at the height of COVID where they didn't even want me to have people in my house. And, I was running illegal parties and I was doing
he'd have soirees. There was a salon.
Like speakeasy parties.
But not just, but people from all sort of political discipline, and nobody wore masks. Nobody freaked out.
I felt that tequila was the ultimate way of keeping
disinfected.
Yeah, exactly. But I remember when the OSHA mandate came out, and they said if you're a company with over 100 employees, you can force everyone to get vaxxed. I remember I was live on air, and I'm looking at my producer and my director, and they're both in their 20s, perfectly healthy, fit guys. And I remember thinking, like, I don't have 100 employees, but what if I did? What right would I have to say because you work for me, you have the privilege of working for me, like I'm the king, that you have to get injected with something. So I'm very proud that none of the guys that I work with, and then it grew up to now we have 12 at my production company and people on this side too, and nobody did, and everybody moved to Florida and everyone's doing just fine. And then when you hear all of these stories about vaccine injuries, and everyone knows people with vaccine injuries. I know a young girl in her late 20s who suddenly is having some vision problems.
But what if there were no mandates? What if we had a world where it was brought out, no one knew, it was a crisis, and it was always free choice.
Sure.
And then we built informed consent as we
always do, have always done.
Right.
Information. What if it just went like that? Where would we be now?
We'd be better, right? Wouldn't we? Wouldn't we be better off?
I think undoubtedly we'd be better.
I think I want to talk about you've spoken a little bit about, I want to talk about your tweet about California and the homelessness thing, which you just, I think a couple of days ago put up. And then I want to talk about mRNA and so-called turbo cancers, which I don't like that term at all. But there may be some increased cancer, something in young people. But talk to us about that. And you also are concerned about multiple mRNA vaccines affecting immune function and thereby affecting cancer oncogenesis.
Well, talk about a great experiment. To give, if we follow the CDC program right now, people our age should be on our 9th shot
of COVID.
Ninth, and then immunocompromised 12 shots.
I have patients.
What a grand experiment that is, right?
Know. Listen, I have patients that probably have had 4 or 5 boosters, I bet. I stopped encouraging at 3. Now, I wasn't even encouraging. I was saying, well, I was just presenting and then presenting my concerns. And most of my patients older patients, they felt they had something to be gained by it as opposed to any real risk, because I have much older patients for the most part. And so the time horizon on living is 10 years max in many cases. And so you're not going to get some of these problems, and they would like not to have the acute problem up front. So, okay. And I've seen very little in the way of vaccine reactions. However, I did make a VAERS report for a 100-year-old lady, 99 actually, who had a severe cardiac arrhythmia, did not want to go to the hospital, as elderly patients often do. They just refuse to go. And I had to manage it all as an outpatient, which I successfully did. Made a VAERS report. On the report, they go, we'll get back to you. Nothing. It was a very significant. She had a supraventricular arrhythmia. I think she had a rapid atrial fib. And she refused to go in with that. And I didn't know where to anticoagulate her. 99-year-old. It was a very touchy situation. And worked out, got her back in sinus, and but
you thought it could be related to the vaccine.
Oh, it was within hours of the vaccine.
Okay, so here's the point: the VAERS system, by proxy of reporting, is is essentially determining causality. It's always been, well, VAERS can't determine causality. Yes, it can, because you've made the decision as a doctor. Yeah. I've made VAERS reports. I only report things to VAERS, Vaccine Event Reporting System, because I want to be sure, number one, and it's time consuming to do it and everything else. But also, if I just put in reports willy-nilly, there's imprisonment or federal fines that I could face. And VAERS has the patient's name, their address, their email, their phone number, my name, all my contact information. So when the CDC says, well, it's not verified, well, go verify it. They can call.
You know how they verify it? They got a guy. They got a guy that decides.
But that again goes to that bureaucratic middle management piece that no one knows really who's in charge when it comes to anything right now. You wonder what's going on at the college campuses, and it's like, who's in charge of any of this? Even in the cities, it's like, all right, well, are the police allowed to do their job or not? So ultimately what happens is there's just sort of a clown car of incompetence as it relates to everything. And then on the COVID side, the fact that they were also telling us to stay indoors and not get outside.
Oh my God.
And that I had people yelling at me because I was walking my dog and all the, and don't work out. And then everyone started drinking more and eat Chinese food instead of cooking and all the rest of it. It was just every layer that we could have been hit on.
Yeah.
We were hit on. And I'm certainly not a scientific expert like you guys
we were yelling
but there's
the whole
a fundamental human aspect to what life is supposed to be about.
How about if you're 8 to 15 years old and when you were dependent on your peers for your cognitive and social development and you're forbidden from seeing them. And if you do, you're trying to kill your parents, your family.
Think about the kids right now that did not get to their high school graduation because of COVID. And now they're not getting to their Columbia or UCLA or USC graduation because of these protests. I mean, you've stolen a fundamental part of their life. And I suspect they will not be that friendly when they're dealing with older people in their day.
Well, I have said that. I've said the 18 to 15-year-old, 8 to 15-year-old, I've tried to speak to them to the extent that I can. It said, you should be pissed.
Yeah.
And I hope you're furious and you never forget. This should never happen to you again. You should never find a way to make sure that this does not happen.
You know, there's a whitewashing going on. My son went to medical school during the time of the pandemic at University of Texas at Houston. So his class is in the beginning, middle, and end of this COVID pandemic, right? And anatomy labs are shut down. They can't go into the medical center, all these different adjustments, testing, vaccines, what have you. I go to the graduation and I listen to every word, the provost, the class president, the guest speaker. No mention of COVID and no mention of the vaccines. So we have the biggest health crisis in history and the medical schools are whitewashing it as if it never occurred.
Well, guess why?
They had a little something to do with it.
They're culpable for the excesses. And were you fired from your job? Is that what happened?
Yeah, my contract was not renewed.
Okay.
At my institution, I was professor of medicine, had a perfect clinical track record.
Professor of medicine, how many thousands of publications?
I have over 1,000, medical communications. I'm over 700 in the National Library of Medicine. If anybody who commented on COVID, I'm the most published person you can get on TV. So my opinion should mean something. I completely took over this field. I was an internist and cardiologist focusing on heart and kidney disease. I saw this thing coming, and in a few weeks, I was not seeing the leadership anywhere to see who's going to step up and treat it. So it was myself. There was a group that formed called FLCC. Didier Riault in France, he's the most published microbiologist in the world. He set up a treatment center in Marseille, France, started treating all these elderly. Trump was given a report from Didier Riault that said, listen, it looks like hydroxychloroquine could play a role. That's where that came from. He's the most published microbiologist in history, and his career is being disassembled by the French authorities.
We've got work to do to build new things and make sure that people can be online and that they can practice medicine in the way that they see fit. And
I think we need.
go ahead.
I would say I think mockery is the order of the day.
Yeah.
I do. I think the insanity. We have to mock that people for their excesses. We have to shame them. They need to be. We're never going to be holding people accountable. But when they say stupid stuff, they need to be mocked.
Well, Drew, I know you have a bit of a checkered history with Fauci, or how do you want to describe it? You have a back and forth with him, let's say.
I was a deep admirer. I don't know if you were. I was a deep admirer. And the reason I got involved in radio is because he was telling young physicians, you got to educate about this thing. He really was saying, you got to scare people is what he was saying.
Right.
And I didn't recognize it as that, but in retrospect, that's what that was.
But think about it. The guy in, I believe it was May of 2020, sent an email to a friend saying that masks don't work. You don't have to wear masks when you go to Mexico on vacation, and your kids don't have to wear them. And then within days, he's out there giving a press conference to continue the school closures and to wear masks. These people, now he retired and he's still getting his $400,000 a year salary, but nobody was fired. There's been no reckoning. The only people who got fired were doctors and nurses who didn't want to get vaccinated.
Right.
So we've never had a reckoning. And I fear that we will never have a reckoning with any of this, a real sort of governmental reckoning. And because of that, we will do it again. They will say, well, it's
we almost went further with the World Health Organization.
Yeah.
I think there's a pushback on that finally, yes? You know what I'm talking about? The World Health Organization Treaty? You don't know what this is?
No, wait.
Dave, this is a takeover.
Oh my God, you're going to go nuts with
You think Fauci and the CDC and the NIH were bad. The next time it's going to be the WHO giving us orders on when to shut down. and masking
I
and
do know
whatever.
about
Yeah,
this.
this is a takeover.
This is sort of the
This
globalist
treaty. This treaty, and if we don't opt out of it, we are in it, and they have authority over all sovereign, duly elected officials,
which is completely psychotic and antithetical. Actually, to the
it's like something out of a
Constitution.
bad science fiction movie.
Yeah.
Right.
It's just I can't believe we're going that way. So back to why. So why does the blob find this? You said power over people. Do you want to have power over people? I don't want to tell me about it.
I don't think it's that much more complex than that. I think most people do want to have power.
Why? What is that? I'm really kind of confused by it. I don't know what that gives anybody.
It's part of the human condition to bend the world to your will.
Part of narcissism.
Well, okay. So then if we go with that, I mean, right now we have we're 25 years into social media, and we probably have never had a more narcissistic, a mass narcissism running throughout society than at any time in history of the world.
But there is a tidal wave of paternalism going on. Did you listen to the comments from Sotomayor and Ketanji Brown at the Supreme Court, Missouri versus Biden? Did you hear these comments?
I did.
The comments, Dave, the comments basically said this. Listen, the government needs to...
Yeah. How's the government going to be a big daddy?
Yeah, the government needs to basically curate this. Mm-hmm. We need to curate what Americans hear. And it was really specifically about doctors. I mean, a lot of this, the amicus curiae briefs that have been filed.
We're going to have Aaron Kheriaty. Have you interviewed him yet?
Yeah, you have to. He's a plaintiff. Yeah.
I've known Aaron for a while, but he's going to be on this show in a week or so.
Oh, good.
Dates up soon. But keep going. Sorry.
Yeah, I mean, the point is, it wasn't as if the Supreme Court was saying, gosh, we're disturbed about what we hear about the government inside Twitter and Meta and what have you. It's not like there was a visceral disturbance of that our fundamental rights are being infringed upon. There was actually a concern that, listen, this is needed. We need paternalism now.
Right.
Well, I think partly to answer your question about the blob just sort of moves until enough people push back. There's entropy to just pushing people as far as they can be pushed. So, for example, we knew 2.5 years ago when Jen Psaki, who was White House press secretary at the time, she said, we're flagging posts for Facebook. That was the Biden administration admitting they were violating the First Amendment rights of citizens. When Jim Jordan, first Elon releases the Twitter files, so now we have a whole, cachet of information as it relates to that. Jim Jordan then, in a congressional hearing, released the long list of tweets and everything else that the government was including. My tweet was on there. So I interviewed Jim Jordan tweet saying that it was in July of 21. I said that vaccines were not working as promised. This was a month after Biden had said, if you get the vaccine, you will not get nor transmit COVID. And I said, I guarantee you they're prepping us for boosters and mandates, which happened that fall. It was just it was obvious. I'm not a genius. Again, I'm not a scientist, but it was just, if you tracked roughly what was happening. Anyway, so that tweet was taken down by the old regime at Twitter. Jim Jordan showed me that it's in these files. And then I interviewed him at the Capitol and I said, well, what is your recourse? If the government violates your First Amendment, it seems like there would be some sort of recourse. There's no recourse. Maybe you could get a letter from somebody saying sorry, but you can't sue the government. You can't get the janitor at the Capitol to just apologize to you or a handshake. There's no recourse.
Well, I mean, Aaron Kheriaty took it to the Supreme Court. Right.
So I'd have to know the specifics of we had something. Maybe he got fired.
He got fired.
So then there's some legal recourse you can maybe have with your organization or something else. But you as a private citizen, if they
you can't just sue the government.
There's just nothing to sue
what do you think?
I spoke to what's her name, the great Harmeet Dillon, who's one of the best First Amendment lawyers in the country.
Yes,
because I asked her. I said, "There's got to be something." Not really.
So we're a few weeks away from the decision. What do you think the decision is going to be for Missouri?
This is Biden versus Missouri.
Yeah,
it's going to be a watered down. It's going to be. I think it's going to go the way of the plaintiffs, but kind of watered down. That's what I'm afraid of.
I predict this actually going to go
the other way.
It's going to go for Biden. It's going to say, sorry, these public health emergencies are too big.
Problem. Yes.
Yeah, it's too big. We have to curate this.
Fiat authority in a so-called emergency. That's the problem. That needs to be somehow adjusted.
Right.
Because to have complete fiat authority over elected officials and everything else is just insane.
I know, but remember, public health emergencies now can have an incredible penumbra because the WHO is saying, listen, not just humans, but all plants and animals. Mm-hmm. So wait a minute, that means a climate crisis is a public health crisis. And it means a livestock issue, avian influenza. I mean, we literally could be in a public health crisis perpetually.
Yeah.
I mean, not to get too conspiratorial on you, or maybe to get too conspiratorial on you, but Bill Gates, who's constantly complaining about cows and methane and all of these things, he's also the number one farmland owner in the United States. Something seems odd about some of this.
Is he ranging cattle on his farms?
I don't know what he's doing on his
or maybe
farms, but he is the number one landowner in the United States right now.
Wow.
Used to be, what's his name from CNN? Used to be Ted Turner.
Was it?
Yeah.
He had all those buffalo, yeah.
Interesting. Yeah. Hey, Susan, are you watching Restream?
Yes.
Any questions coming up there?
Well, they're very much into going
Okay, we discussed that, but I'm willing to discuss it again, which was we talked about how repeated vaccines may increase decrease immune surveillance.
Right. I published a Substack on this on Courageous Discourse. 1984, Sutherland and Baylor published a paper that said, listen, if some external toxin or something else that gets into our body, if it's really going to cause cancer, it has to work by multiple mechanisms, not just one mechanism, multiple mechanisms.
We have a cleanup system in our body.
Right. So we have redundancy. Yeah. Right. So we can, one little thing, we can handle it. But you get 2 or 3 things at once, we could form a cancer. So a paper from University of Oregon, Anguis and Bustos, published last year, said, look at these messenger RNA vaccines. The messenger RNA almost certainly impairs DNA repair. So that's mechanism number 1. The spike protein, which we get exposed to with the infection and with the vaccine, but the S2 segment of the spike protein, by modeling study, University of Pittsburgh, Singh is the first author, impairs P53 and BRCA tumor suppressor systems. So now our natural surveillance systems could have a drag on them. And then the final mechanism was the breaking news. 4 labs have shown it, 2 manuscripts in the preprint server, one by McKernan and the other one by Spiegler, showing DNA fragments in the messenger RNA products. It's called process-related impurities.
And plasmids.
Particularly SV40. It was called simian virus 40. This were the same fragments that actually contaminated the polio vaccines from 1955 to 1963. The jury is still out whether or not SV40 itself is directly oncogenic. I mean, I've looked at that carefully. But now there's enough there to make us concerned that, the shots are lasting a long time in the body. They're in the lymph nodes. We have, United States, we have about 20 million cancer survivors among us.
I'm one. Kelly's one.
Okay. Yeah. So we have, so cancer survivors are common, and you're somewhat vulnerable, right? Is there a worry that there could be a recurrence? We have not only that, but we have a proneness to cancer, right? So we have family history. We have other environmental exposures. Now we're taking long-lasting shots with a new genetic mechanism of action and multiple features to them. Could the next cancer, in fact, have been related to the vaccine? That's what we're in right now. So if we look at the cancer registries, all the cancer registries are up right now. Post-pandemic, cancer is on the rise. There's no argument there. Going through all this, now we look in the peer-reviewed literature. So Karagakos and colleagues, I'm the senior author, we published a paper of a man who takes the shot. It almost certainly looks like within a few days, the cancer was already there. It was a basal-like cancer, probably in his parotid. It literally just took off, exploded, invaded his brain, and killed him. Oh. Now we have another paper. Gentili's the first author. Again, I'm one of the author in the writing group. Now we have lymphoblastic leukemias completely looks like temporally related to the vaccine. And it wasn't just this case, but now there's 9 other cases. The point I'm making is all these cancer registries that are linked to the National Institutes of Health should immediately have a linkage to the CDC data, and it should be explored. I'm an epidemiologist. We should explore this.
Put that last screen up there again, Caleb, if you would, about cancers over there. So now people are getting confused about cancer deaths and cancer incidents too, because cancer, we're doing a wonderful job treating cancer. So deaths are actually going down, but incidence is up, particularly in younger people. And it's been going up since 2009 though. Right. And but if you look at it, it's sort of the slope is rather steady, and then it takes a tick up at 19 as though a second thing maybe happened.
Well, listen, there's been other explanations proposed, to be fair. One of them is just what's called a lead time bias. So during the lockdowns, people missed their mammograms, colonoscopies, other things.
The UK sort of ruled that out, didn't they? They looked at that very carefully because they've got all that data, and they're saying it's not screening. It's not that. It's not people coming in with symptoms or sickness. That apparently didn't significantly affect the incidence. or the way the cancers went.
It should be investigated. And the new thing is the vaccines. You point out we're all just to take it. The CDC has all the data. The vaccine administration data set should be a public use data set, and we should be able to merge it with cancer registries, all-cause mortality. There should be a full-throated effort to vet this now because people have questions.
Do you watch John Campbell at all? The
No, not
nurse.
really.
He's a British nurse, PhD, who was doing kind of what I was doing, sort of French undergrounding during COVID. Like, what do we understand this? How do we do it? He's trying to show the data. Very, very systematic, brilliant guy. And he started all of a sudden going, wait, something's wrong. Something is up here. Why are they mandating this thing? Why are we doing it? And one of the things that is never discussed is during Alpha and Delta, you could make a case for the vaccine even if there was significant risk from it. Let's say we admitted that it was pick a number, risk. Alpha Delta, I had it was brutal. It was not the flu. I'm sorry. It was brutal. I had patients die of it. It was a brutal illness. And a vaccine that had some risk made some sense. But by the time they were putting mandates in place, we'd already gone over to Omicron, which is an entirely different situation. Most people had natural immunity, and it was just a completely different circumstance. And yet they're staying with their original sort of attitude on vaccination in an entirely different clinical circumstance.
I got Omicron. You remember if it was that week it was Christmas week 21 when it really blew up, and I got it in LA, and then we moved here. We didn't.
That's where I got it. I got it too. I was at a party at your house.
Wait,
you had a party before you left.
It's very
Maybe
possible
you got it from me.
Were you guys kissing or what?
One way or another. No, we had indoor parties. We were real.
There you go.
Well, you but indoor. His house opened all the way out to the outside.
Your palatial estate.
The fact that I left that house is still killing me, but that's how badly I had to get out of California. But I remember getting here, and you could get monoclonal treatment here in Florida. I got monoclonal treatment. I think it was either the day we got here or the day we got back. I was fine.
There you go.
My only COVID symptoms truly were that my knees hurt a little bit. That really
always safe and effective. I used them extensively through the pandemic.
I was going down. I was having a bad case of COVID, and during the infusion, I started feeling better. Yeah. The colors of the room got brighter.
That's it.
And I told the nurse who was doing the infusion, he said, "Oh yeah, I hear that all day long."
It's a travesty. We had pre-purchased doses for every American. Well, every ER should have had those.
Bamlanivimab, and I did Instagram lives every night while I was sick, going, the public health should be teaching you how to get well, how you should treat your family members, what can be done for this. And what I got back was, oh, you're special, you can afford it. No, it's free. Government already bought it. But then, right after you got your Omicron,
then Biden came down and tried to cut it off. Yeah,
he cut it off.
They pulled him. There was 5 of them. They pulled him off one after another. Yep. Ron DeSantis down here went nuts.
They cut off Florida.
I know. That's what I'm saying. Ron DeSantis went nuts when essentially they started to rig the distribution of them.
Yeah. That's what that was.
Yeah.
Forget.
Look, the silver lining to all of this is that...
Is there a silver lining? I guess it showed us what's really going on.
It showed us a little bit behind the curtain, right? So we saw that the great and powerful odds isn't that great and powerful. That's part of it. It also showed us that we're going to have to build new things, and we're going to have to think about healthcare differently. We're going to have to think of our institutions differently. I'm more where you guys are more on the science expert side. I'm more of a media creature. And one of the things that I'm very happy about right now is the trust in mainstream media has absolutely collapsed.
And it's going down further.
And it is deservingly so. There are risks that are associated with that, because if we have no common sense making apparatus in a country, then over time you could see why that could become a problem, because between algorithms and just the endless bad ideas that are now floating around, that could become a problem. But the attention and the amount of trust that we have given CNN and the New York Times and the rest of these institutions, perhaps 20 or 30 years ago, they were better, but they're pretty horrible now. And I always say, it's like, we don't need them to be that great. Americans will swallow a lot of BS. We're distracted. It's a function of our success that we're doing other things. So you can lie to us about almost everything, but not everything. Yeah. Because then people start waking up. And I think that that's kind of where we're at right now across the board, whether it's related to health or whether it's related to media or the way they've lied to us about the border. I mean, we could do this on almost every important topic.
I agree. And I think it should be more, they should be doing worse than they are, frankly. You know what I mean?
I'm trying.
Yeah, well, if I can help, please let me know, because it's offensive the way they. I won't do print interviews. I haven't done them for years because they're never. You ever heard of Gelman amnesia? Either of you? Gelman amnesia?
No.
Michael Crichton tells this story, I think, on a Charlie Rose interview. He goes, there was this physicist named Dr. Gell-Mann, Gell-MANN. And he said whenever he's reading the paper and comes upon a physics story, he was a physicist, he'd go, oh God, they cannot get this right. They're just this is a lie or it's complete distortion. It's just so wrong. And then he'd go on and read the rest of the paper and assume the rest was accurate. As compared to only physics, they were off base. Have them write a story about you one day and you see how off base they are. They just go into crazy zone. I mean, dude, your thing with the that you have on your framed in your studio now.
Me and Jordan Peterson and Milton Friedman and Thomas Sowell were head of the alt-right. I mean, pretty impressive.
Well, the thing is,
congratulations
on the print.
Do you go up in the mountains now where and get your, what was it that
what do we do up there in the mountains?
You're getting your militias together.
Oh, the militia. No.
What's your name that said that?
We have militias all over.
What was it that said that? Help me. So she's an African-American, older congresswoman from Los Angeles.
Oh, Maxine Waters.
Yeah.
But here's the point with the print interview. You can't control the final product and it gets out there in print. When we're doing this, you can control every word.
Of course.
You control every word. You control the content. You know exactly what you're saying.
Yeah.
And I agree with you. Early on, Bloomberg wanted to interview me.
Don't do print.
I did a print interview. I said, oh my Lord.
Yep.
It just what came out. I said, never again.
Well, the people that write it don't see it as their job to actually report what you said. Their job is to make a case or tell a story.
No, they've become activists largely instead of journalists.
Yeah.
I mean, I wish we could probably, if the three of us just really sat here and tried to figure out how many true journalists remain in the United States, we could probably do it on two hands. And that's sad and dangerous. And it's really dangerous. And it puts a lot of pressure. The funny thing is, people come up to me all the time when I'm out here in the store or wherever I am at the park. People will be like, Dave, you're the only one I trust. And I'm like, man, we are screwed. We are screwed. I'm doing the best I can, but I'm not an expert in most of these things. I think I have a way of taking what's going on in the world and communicating it to people in a decent way. But if that's what somebody is left with, then where we are at as a society is a really, really dangerous spot.
I'm not sure that's true. Well, we'll see how that plays out.
I hope you're right.
I think you ask great questions and you allow people to provide the information, you ask more questions.
Then you guys should work on cloning, because then there should be an awful lot more of people doing what I'm doing. I don't think it's rocket science in that sense.
It's what we're doing here. It's what a lot of people are doing. It's what this studio is all about. Susan, anything else on the restream? Oh, thank you for...
No, sorry. Caleb said there's thumbs going up on the... I don't see
There's thumbs up for independent media. You know, I have a lot of colleagues in Australia, and they're coming up against some really tough measures that are going to be taken. And, I've got a podcast. It's on an independent platform. And I talked to the person in charge of that platform. I said, listen, if Missouri versus Biden is decided in favor of the government and it's game on for government censorship, it's game on. You could say, okay, Twitter's going to go down and Getter's going to go down and Facebook and what have you. But I asked him, I said, what are you going to do when the government knocks on your door as the curator of a independent media station and they say, you know what, we didn't like that show Dr. Drew had on. What are you going to do when the government now starts to go after independent media?
Well, I can give you one, at least slightly self-serving answer, in that Locals was ultimately, we merged with Rumble, and Rumble is now the parent company of Locals. Rumble is building the new infrastructure of the internet. So Amazon AWS, Amazon Web Services, that's what the internet is basically built upon. Virtually it's the most ubiquitous, virtually every website is built on that. So when Parler went down after January 6th, it was because they were on Amazon AWS. I don't know that I've said this publicly, but I'll say it real quick. I had a meeting with the Parler guys talking about Locals and seeing if we could kind of work together before January 6th. And they started telling us about their infrastructure. And I was like, do you guys realize that they could just take you out like that? And that's literally what they did. I don't know if it's a touchscreen slide or it's a thing you have to pull or whatever it is. But that's the softest spot of the internet right now. They can basically, even Twitter, I think it's public, that Twitter is run largely on Amazon AWS.
Oh yeah, everything.
That's a huge problem. Now he's buying server farms and all sorts of other stuff. But Rumble has server farms all over the place. I don't even know where they're at because I'm not supposed to know, because they need to be in all sorts of places. So, but there's an information war and a technological war that we're fighting on a million other levels. And actually, your question really is the right one, because even if your website still is up, when they come to your door, how much are you going to be willing to fight? And then that's what anyone has to think that's going to be a little bit outside the mainstream.
Or what are you going to do like in France where they say, listen, Rumble's not available? Or in Brazil, let's just kind of turn off the lights.
Mm-hmm.
Yep.
What's going to be the workaround and all of this? And people in Australia, France, Brazil, the discussions about the importance of independent media, it can't be more tense right now. People want the truth, and they are developing an extreme distrust all over the world at the same time of the government and essentially the government-controlled state media.
Well, that's the powerful part, right? So that's the white pill of all of this, is that so many people have woken up. We are at a time when, there's blockchain technology and peer-to-peer technology, that there will be a way for the internet and for people to continue. And the real beauty is, at least from a government perspective, is the government's they're not getting the best and the brightest anymore, right? Maybe they did 50 years ago when NASA was trying to send us to the moon, but they're not getting the best and the brightest anymore. So it was one of my arguments always when people wanted to regulate Google. It was like, all right, you're going to send in a government regulator to deal with the Google algorithm. It's like, these are not the people that can deal with this.
Dave, that's how medicine is regulated. I got news for you.
No, but that's what
it's how it's been.
But that's what I'm saying. So maybe that's the silver lining, is that the machine itself can't really keep up with the rate that technology can solve new problems. And in some sense, that's what the race is about.
Russia apparently banned Rumble today.
Is that right?
Is that right?
Mm-hmm.
Well, we've got ways around that.
Look at you!
I'll have to talk to the guys. I didn't hear that.
But
today.
You mentioned Jordan Peterson and crowds of 7,000. I went on an Australian tour, and we easily had 5,000 major venues, and we just told the story of what happened through the pandemic. You can't censor the live program.
Yeah.
Now, when they try to do that, and now we can't even. Now we're getting down to Nazi Germany, really, where you can't meet and talk. You don't have freedom of assembly.
Look what happened in Canada. I mean, they went after the bank accounts. So there's always ways that they can try to pressure you and it's fear more than anything else, right? They're going to just apply fear so that, even if Trudeau felt, okay, we don't have to take out everybody's bank account, but if we can do it to enough people, and I interviewed one of the leaders of the trucker movement right in this chair a few months ago. She's still caught up in all sorts of legal stuff. And what that does is it sends a signal out to the rest of the country, like, all right, just be wary of next time you do this. But look, Trudeau is still in charge of Canada. Newsom is still in charge of California. Biden is apparently still in charge of the United States. So we got work to do.
There's one historical truth that I know to be so through my study of history, and that is when the guillotines come out, they're coming for you eventually. Yeah. If you pull out a guillotine, you'll be up on the guillotine. It's just how it works.
Wow.
The other thing is, do you know Matthias Desmond? Have you had a chance to talk to him yet?
No, I don't think
He's the guy that came up with came up with the concept of mass formation. Really interesting dude.
Well, okay, so I don't know him personally.
Yeah,
but
and I did a long interview with him the other day. It's up on one of our Ask Dr. Drew on our website, and he said that the way he was studying them before this all hit. He was sort of fascinated by them, and then he ended up writing a book called The Psychology of Totalitarianism. Yeah. And in that book, he showed that about 20% of people get hypnotized very easily. They are just very prone to propaganda, and they get very gratified. And the narcissists get way into that. About 70% of people just hide. They I don't want to lose my job. I don't want to get in any trouble. I'll just go along to get along. And about 5 to 10% see the bullshit. So throw the flag. Yeah. Throw the flag. So the really interesting question going forward is, how do we expand that group, the 5 to 10%? How do we get the 70% to feel strong enough to stand up to that 20%? And how do we get that 20% to shrink a little bit?
Well, I think one thing we have to do is give the devil his due, which is that we have to acknowledge that these people have done a tremendous amount of damage. I mean, you've confused a generation of kids about, as I said earlier, the founding of the country, whether their genitals match their gender, a series of other things. If you even look at these college protests right now, have you seen some of these videos where just random people go out there and ask them, well, what river to what sea?
Yeah, they
don't know what they're protesting.
Yes, they're just hypnotized.
And they're here and they're chanting crazy things that they have no knowledge of.
Yeah.
They're stepping on other students' rights to free speech and freedom of association and movement and all these things. And they think they're the good guys while doing it, which is the most dangerous thing, right? Because most bad things are done in the name, Hitler thought he was a good guy. So
100%.
So you have to give credit to the people that took over the institutions, that destroyed so much. The institutions that you guys probably really cared about and trusted for a long time, the media institutions, all of them, they were rotted out. We have to acknowledge it. We can't just, they're just blue-haired morons and we can make fun of them all day, but there's something much darker going on there. They've done an awful lot of destruction while the rest of us, I suppose, live lives. And
we need to really get focused and stand up and keep talking. And I think I like to stop on the white pill. I think to have the idea that there is a white pill here, when the day is done, the fact that we're seeing this, that we're talking about it, that we have Rumble and outlets and places to go to sort of express ourselves. And again, for all of our people out there, we appreciate you being here, listening. With the Rumble Ranchers, I know we're up and busy. Susan's got her eye on them as well as our people on Restream. We go out on multiple platforms, but when we get on that Rumble homepage, it helps. We reach a lot of people, and I think we are there today. We built it, so I'm thrilled. And I thank you for that. Thank you for Locals, Peter. Thank you for all you've done. And I do think people should get the book, Courage to Face COVID-19. When I was reading, I really mean this. I felt like, this is a historical document. This is a history of what happened. It just, you were the victim of an extraordinary story. It's more than you imagine what they put him through. And for you, anything we should be promoting other than your Substack or the Rubin report?
I said a lot of nice things about the things that I'm doing. People can find me. No, that's it. That's it. I got the book and I got the show and just living my life in Florida.
Living large in Florida. That's right. And I'm jealous. I think I've been down here 3 times in the last 6 weeks.
I'm basically your real estate agent at the moment. So that's pretty much where we're at.
And my mom or something. It's like, come on, you need to move down here.
Let's go. All we have is freedom, a functioning society.
That's it. I keep getting closer.
Good weather, nice people, joy, happiness, the American dream. But no, stay in Cali.
I keep getting closer to Joe Latipo too, and and he talks about how great it is here. And so, well, listen. Tomorrow, Kelly Victory will be in here. Dr. Kelly Victory will be with us. I'm blanking on who we're joined by. We're joined. Viva Fry is coming in. Viva Fry with Dr. Kelly Victory.
I know Viva.
Dr. Paul Alexander comes back around. Dr. Joe Latipo on May 15th. Aaron Cariotti on the 16th. Tulsi Gabbard on the 23rd. I think did you just interview Tulsi?
I did. Yeah. And if you want to fix this thing from a political level, you're looking at Trump's VP. That is my belief.
You think that's it?
Yeah.
Wow.
Yeah, because Trump, the most important thing for Trump to do right now is he needs to bring in new people. He needs to bring in all of the people that have woken up, all of the libs that can't deal with the lunacy of the Democrats anymore, but a lot of them have an aversion to Trump. He needs to show a signal to them that they can get there. She's a current member of the military, lifelong Dem who just left the party. She hasn't said she's a Republican, but she's campaigned with Republicans. She's evolved on certain issues where she was more wary on Second Amendment, but she's come around on that.
Yeah,
she's great
on
free speech.
You emphasize that a little bit.
Well, I wanted to go through the points with her that I thought would help her. That would help show that she's on the right path right now. And I think it will really do well because the one thing that Trump is struggling with still, struggling with a whole bunch of court cases and other stuff, but to get that, let's say, 30 to 60-year-old left-leaning liberal woman who they get it now. The cities are burning down, all of the lunacy, but they can't go for Trump. She represents what they could potentially go to on a softer face, and she's an absolutely lovely human being.
Oh my gosh, we've had dinner with her. She you ever met just delightful. And her husband's a great guy too, and surfer and runs all her stuff. Really cool guy. Yeah. And well, good. That would be great for the country just to have her in a significant position.
We shall see.
So we shall see indeed. All right, we're wrapping up, everybody. We appreciate you being here. I think I have to read something about our My Pillow friends before I wrap it all up here, just to sort of throw that up there. There we are. I was with Mike Lindell last week, and he then made us an affiliate. So go to drdrew.com/mypillow or mypillow.com/Dr. to get. He took the Drew code away from somebody else. You'll get all the special offers Mike Lindell has set up for us. The promo code is Dr. Drew now. It's D. I think he said it was Drew. It's now DRDRAW. Wait, what? Drew works too. Okay. And mystore.com, you can get it there as well. But we went on and got blankets and beach towels, all kinds of stuff. So, Mike's a very interesting guy. So do support him and support us. And we will see you all tomorrow. We're going to be at 2 o'clock tomorrow, correct? 2 o'clock Pacific time. We'll see you then. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.